this is actually an analysis of PERSIST-2. So recall that PERSIST-2 was the phase 3 trial of pacritinib versus best available therapy, which could include Rux, right? It could include Rux, and it did include Rux in about 45% of patients. And these are patients with less than 100,000 platelets, all of them. And also they could have had prior Rux. So a lot of little details there to remember. So they could have had prior Rux, and again, about 45% had received prior Rux, and then the BAT could be Rux, which again was around 45%. So this particular comparison is a comparison of pacritinib to the patients who received Rux as their best available therapy but had not had prior Rux. So that's important to understand. So this is first-line Rux versus first-line pacritinib, if you think about it, because these are patients with less than 100,000 platelets, no prior Rux, or no prior JAK inhibitor. So you're looking at pacritinib versus Rux in these patients. Now, I will say that the number of patients that fit into this category in the trial was rather small. It was 12 patients in the Rux group, who again fit these criteria. That is, no prior Rux and receiving Rux as their BAT. And I want to say it was around 57 pacritinib that the comparison was performed against. So with that caveat that the number of patients on the Rux arm was quite small, with that caveat, the results were clearly in favor of pacritinib in terms of both spleen and symptoms.